right. Good afternoon, everyone. My name is Maeve Williams. I am the Vaccine Education or Peer-to-Peer Project Manager here at North Dakota State University Center for Immunization Research and Education. Today, I have the pleasure to introduce Dr. Jon Ulven, who will be presenting this webinar titled Change the Conversation, Motivational Interviewing and Vaccine Hesitancy. Dr. Ulven is a licensed psychologist and has worked for Sanford Health for 20 years. He completed his PhD in counseling psychology at the University of Kansas. Dr. Ulven is the department chairperson of adult psychology in the Fargo-Moorhead area, as well as the co-training director of Sanford's predoctoral psychology internship. He has been practicing and teaching motivational interviewing for 18 years. He was involved in a published research study involving pediatricians, MI, and vaccine hesitancy in 2019, as well as an invited speaker to the North Dakota Immunization Conference in 2022. Dr. Ulven, you can get started.
All right. Well, thank you, Maeve. It's really a pleasure to be here. But I will say this, how many out there were hoping for a snow day today? And then if you're like me, how many out there had children who were really hoping for a snow day today? My son was just mad this morning that the weather did not turn out. So I'm, again, happy to be here. Hope everybody safely got to where you needed to go today. Change the conversation. I think the title of this, I hope, says a lot, and that's what I hope we get to focus on today, which is, so often when we encounter hesitancy, whether it's vaccine hesitancy or what I would just say change hesitancy, we have a tendency in healthcare to hear it, but we'll often try to explain our way through it. And those conversations can often be exhausting, if they feel futile. And so my hope today is that you'll walk away with some ideas about how can I do this differently. So with that, why am I here today? Maeve, you did a nice job of introducing me. I would just add that I've worked in lots of different places within our healthcare system with lots of different teams. I worked in primary care for many years, and so I feel like it just gave me a really good exposure to what life is like and with various health professionals. I do some ongoing work with our residents in family medicine, and in psychiatry. So I think that that's been really helpful for me to understand a bit about how health systems and community practice works. I am a practicing psychologist. I'm our department chair. And I think Maeve said 18 plus years. I think that's right. I put 15 here as far as how long I've been teaching motivational interviewing, because I think it is such a valuable part of how we engage patients in care. So we're going to talk a lot more specifically about that. But I put here on the last point, we have a very difficult task today that I hope we can embrace together. And it's that when people hear about motivational interviewing, a very common response is that people will say, I think I already do that. And what's interesting is that when we take a look at people who say, you know what, I'm pretty confident that I'm doing motivational interviewing, and then we actually look at their work samples, what we find is that they're really not. Certainly, there are elements that we all practice when it comes to motivational interviewing. But my hope today is you'll walk away with some ideas that I hope are going to be challenging for you, and they're going to feel clunky when you start practicing them. It's going to feel weird, and it should feel weird. But it's one of the things I will note is that this is not like me saying, hey, I'm going to talk to you about a certain type of surgery you can practice, and then because of my, hour-long talk, you can go and try this surgery. Of course, we wouldn't do that. But when it comes to motivational interviewing, the trainers of this suggest that if you're a well-intentioned clinician, you can absolutely try to do some of these strategies we're going to talk about today. So just to get us going right away, what I want us all to think about is I want you to think about a recent patient, parent, or customer interaction that you struggled with. The kind of interaction that when you think about it, or when you saw the person, makes you internally sigh and go, oh boy, here we go. The type of interaction that resulted in you feeling some frustration, maybe disappointment. Maybe for a lot of us, we feel the imposter phenomenon, which is like, do I really even know what I'm doing? So there's a lot that can happen emotionally in these situations. And so what I'd like you to do is really take a moment and picture you picture this patient customer interaction. And I'd like you to think about this question. Where would you say you are now in your work with this patient? So if you just think about, like, where are we in this process of healthcare? And then the next question is, I want you to think about, where would I like to be with this person that I'm interacting with? And then the last part is to think, okay, what's getting in the way of that happening? So yeah, again, please have a particular case in mind or situation in mind, and then think, where am I now in this work? Where would I like to be, and what's getting in the way? And now let's flip this a little bit. And what I'd like you to think about is, imagine for a moment that you are this customer, this patient, this parent. Imagine that you're this person. And do your best to really kind of put yourself inside this person's shoes. And now, similar questions. So I'd like, if from the perspective that you could guess, from this patient, customer, parent, if I went to this person and said, hey, where are you now in this work with your healthcare professional? What would they say? And if I asked them, where would you like to be? What would they say? And then the similar last question of, what's getting in the way of that happening? And I'm going to highlight, there's this, I listen to this podcast periodically. It's called Hidden Brain. It's an NPR, National Public Radio based podcast. And I love this podcast. It's very research, evidence based. And this particular episode was from February 5th this past year, and it was called Win Hearts, Then Minds. And the question, they were thinking about this political atmosphere that we find ourselves in, and they were interviewing a psychologist who's been doing research on how we form opinions and how people can challenge and change opinions. And the question was, can you really change someone else's mind? And so this podcast is focused on this person's research that demonstrates you absolutely can. But here was I love this. The punchline of this was, you have to listen so intensely to the other person's opinion that you risk changing your own. And that was a really powerful takeaway, because when we think about this exercise that you just did, to think, like, how intensely do I need to be attending to the person across from me, that I risk changing my own opinion on the matter. So if you're interested in that type of thing, please take a look at that podcast. The other thing that I'm just going to share is, we're going to come back to, I'm learning from the first time I gave this talk, which was earlier this week. And what I'd like you to consider doing is that, if you have had an interaction, or there's something that a patient or a customer has said to you, and your thought is, I don't know what to say to this. If you would take a moment, put that in the chat. And then as we go through, I'm going to try my best to try to work some of these things, some of the comments that you make, into that chat function. All right, thanks for that. So moving on here, I want to just get at, one of the things when it comes to motivational interviewing is that it's really not an intervention that is heavy on technical, here are technical things that you can do. More so, it's really about an overall approach in relationships. And so to get at that, we have to think about, what are some beliefs that you and I have that can get in the way of us doing our effective work with others. So one of them is when we have the thought that, wow, this person really ought to change. And we often think about it like, this person needs to change right now. And And if you think about that, what that does is it puts pressure on us. It puts pressure in that moment, and it's going to take us away from the ability to engage with that patient. Another thought would be to think that this person really wants to change, and you know what? Often we make that assumption, and that assumption is incorrect. And so then we go about doing things like, I think about how in a health system we kind of set up our partners to fail. We put in referrals that the patient is never going to go to. They don't even it's often the case in behavioral health that we'll reach out to someone, and our staff will reach out to someone and say, hey, you got a referral to see Dr. Ulven here in psychology. And the patient will say, what? What is psychology, and who is this person? And so thinking that when we believe that somebody wants to change, we often help push them through on our ideas and our treatment plans when they're not ready. Another one would be that health is the primary motivating factor for patients. As all of us know, if you think about when we have had thoughts of like, I should really be exercising more, I'm going to eat healthier. When we have those kinds of things and we think, well, what gets in the way of that? It's that life gets in the way. So sometimes even when the patient has, made time out of their schedule, perhaps traveled to you, showed up in your office, and they're sitting there, it's really easy to think that that health is the prime motivating factor when sometimes it's not. If the patient does not decide to change, then the consultation has failed. In motivational interviewing, one of the things we're doing is we're really trying to work with kind of the internal levers of the patients that we're working with, or the customers, and we're trying to help them make some change. Sometimes we can't see that in the consultation, but we're planting seeds. Another one is that patients are either motivated to change or not. We often think about it in that black or white fashion. And in motivational interviewing, what we're doing is we're looking for the multiple factors that influence our decision making, and recognizing that often there are lots of different and competing motivators for our patients. Another one, similar to what I said before, that now's the right time to consider change. It might not be. We know this one, a tough approach is always best. We know that doesn't work. I'm the expert, he or she must follow my advice. Well, we know that one also doesn't work very well, especially in this era of we've got more science skepticism, medical care skepticism. And so that one also doesn't work. And the last one, motivational interviewing always works. Of course it doesn't. Motivational interviewing is an approach, and there's a lot of research behind it. We'll get to that in a moment, but it doesn't always work. So let's talk a little bit about what is motivational interviewing. Here's a definition that I like. It's a particular way of talking with patients about change and growth to strengthen their own motivation and commitment. I think sometimes for those of us who are like the old school Saturday Night Live fans of like Chris Farley and the Man Down by the River, and the motivational, that idea is he was a motivational speaker. I think sometimes people have some ideas about that with motivational interviewing, that it's like, if it's motivational, it means it's uplifting. It means that I'm using my words to like craft this really clever thing and tell the patient this so that I sway them in a particular way. And that is not at all what is meant by motivational interviewing. The use of the word motivational was simply to just think about whatever gets a patient or someone moving in their life, whatever helps them move toward change. And interviewing was used to demonstrate that this is a type of interaction in which one party has a guiding role. I really like that idea that it really, we'll get to this in a moment too, about us being guides. So, and that's from Miller and Rolnick, and those two I'll reference a few more times today. They are really the two originators for how we use motivational interviewing in the United States, and they're still active, even though I think both of them are they probably should, they're in that retirement category, but they keep going. So with that, we're gonna do a quick exercise to demonstrate motivational interviewing. I think that I think being able to see it in action is probably one of the most important things we can do in a talk. So I've asked Maeve to help me out. And there you are, Maeve. Thank you so much for helping me out. There are two parts to this exercise. So what I'm going to ask Maeve to do is to choose something that she is thinking about changing, or something that she feels like she should change or want or need to change. And it's something that she's still on the fence about. Um, and so, and then here's what I'm going to do, and you'll all watch me do this. I'm going to wait till I understand the gist of what she's saying. And then what I'm going to do is I'm going to jump in, and I'm going to interrupt her. And you'll see what I do when I interrupt. So Maeve, do you want to take it away?
Sure, yeah, I think I'm gonna try and adapt it to something we had suggested in the chat here. So I guess I just don't really feel like taking my medications a lot of the time. I just feel, I don't know.
Oh my gosh, Maeve. So Maeve, okay. Thank you for telling me that. Your medications are terribly important for you. We've got your healthcare professionals. They went to school all those years to try to help understand the human body and how medications work in the body. They're very knowledgeable. They know what they're doing. And if they've prescribed you medications, you really should be taking them. And you should be taking them following the prescription that your provider has given to you. And there's a reason why they have that prescription, like the frequency of how often you should be taking it and considering when you should take it. I would recommend that you follow like it to make sure you're taking them at the same time every day. And knowing just for sure, like, do you need to take them with food, without food, following those instructions. And when you do that, Maeve, it really helps you to manage your health better, which I'm sure, you're a young, active person. You want to be as healthy as you can be at this time in your life. And so to do that, if these prescriptions have been out there for you, they really need to be taken on a regular basis. And so what I'd really like you to just get out there and just get back to it. It's really important.
Okay.
All right. Yeah. Okay. So there we go. So I'm gonna just ask. Now, this was I kind of jumped in there and I hammed it up a little bit, and I was probably a little bit more blunt than I would have normally been, for sure. But Maeve, how was this for you? What worked? What didn't?
Yeah, I feel like maybe you made a lot of assumptions about me, about why I wasn't taking my medications, about my level of knowledge on the subject. And I didn't get a word in edgewise. So at the beginning I was interrupted. I didn't get to explain any of my why, and didn't really feel like there was a plan or a motivation for me to want to start taking my medication again, other than being told I should, which I feel I already know how. I know I should, but I just haven't gotten there yet.
Oh, thank you for that response to it. Yeah, so several things. One is you're saying I was not heard. Two, the person has no idea. Like, I had no idea. I didn't even give you the chance for you to tell me how knowledgeable you are on this subject. I don't even know exactly what the problem is. And then you're saying, look, I know I should be taking them. I'm having a challenge with it. So then we don't even get to the challenge itself. So I really appreciate that. Was there anything about this that was helpful?
You used my name a lot, which made me feel like you knew who I was as a patient.
Look at that. You really, that's great. You really had to search for that, right? But one of the things I think I'll spell out there is that there was a study. It was done many, many years ago now, but I think it's one that I hope does not hold up any longer. But it was looking at a primary care situation, and the question was, How long does it take for a primary care provider to interrupt a patient once a question's been asked? And the answer for that study was 18 seconds. And so to think that person who has potentially vital information about their health, they essentially had 18 seconds to share it. And so now we're going to try a different route on this, and we'll see how this one goes. So so here we go. So Maeve, now for this one, same topic, and what my role as the listener is to simply ask these questions. And I think what folks will notice as we go through it, I'm not going to deviate much from these questions. I'm just going to listen. I'm going to ask, listen, and then move on to the next one. And so, and just again to think about how does this way of interacting with Maeve, how does that impact things? So, hi Maeve, good to see you. I'm using your name a lot so that you feel comfortable and heard. Would you please, Maeve, tell me, why would you want to make this change?
Well, I know I should take my medication. I know I feel better when I do take it. And so it helps me feel better. It helps make me healthier. So I know I should.
Okay. Yeah. How might you go about this to succeed?
I guess I've considered getting like maybe one of those pill boxes that has the day of the week to make sure I take my pill every day, or leaving my medicine bottle in a convenient location where I would see it and remember to take it every day, or maybe even setting a timer on my phone.
Mm-hmm. And will you tell me just what are some good reasons for you to make this change? Why is it important?
Well, I definitely feel better when I'm on my medication. I feel more myself. I feel like I can do more of the activities I like to do. And overall, I feel good when I do take my medication.
Mm-hmm. And how important is it for you to make this change, and why?
I'd say it's really important to me because I do want to be able to go do things. I want to be able to go out with friends. I want to go get groceries, be able to go out and about and, do the things that make me happy. And uh, I don't know, I guess just feel more myself and be healthier knowing that I'm taking them.
Mm-hmm. So, so what do you think you'll do?
I guess I think I'll probably start with putting my medicine in a convenient location and maybe setting a timer and see how that goes first.
Mhm. All right. Okay, now we get a chance to debrief this. Thank you very much for that, Maeve. That was great. Um, so, so I want to just throw out to the group here. If this was me and I was interacting with folks, and we'll get to some of the other skills and strategies for motivational interviewing in a moment, I would be responding to some of there was just so much, Maeve, that you offered in the response to these questions. But I wanted to show like what happens when you just if you just use a list of these questions and go through it. So my question to you, Maeve, is say a little bit about what was that like? What was it like this time for you?
I definitely feel like I had more of an opportunity to share my why, and saying it out loud made me think about why I'm not taking them, and how I really should take them, how I feel when I do take my medicine. And so it did make me want to be, I said I was happier when I take my medication. So it makes me want to be happier. It makes me want to follow through on those, having somebody to talk through. And I felt like you did care, you listened, you asked follow-up questions, that sort of thing.
Mm-hmm. Yeah. So, um, a couple things. One is that idea of the why. You got a chance to remind yourself of like, why does this matter? And that I didn't have to give that to you. And then what I thought was awesome was that you came up with the how. Like you came up like here's how I'm going to go about making this change. And how much better is that for you to have done that than for me to say, well, here's how you can do this. I don't even know you, Maeve, and I don't know what your home situation is like. I don't, and so you came up with some nice ideas that are actually workable. So other thoughts you have, Maeve, or anyone else in terms of out there in terms of the chat, if there's any other reactions to this process?
I don't think I have much follow-up. I guess maybe I was kind of struggling to come up with reasons why. So maybe how would the conversation have gone if I had said, I don't know how I'm going to make the change. I don't know.
Yeah, well, that's when we would move into some other strategies, which, so I'm looking at here, we got a couple of nice posts in the chat that we will come back to, and we'll apply that. So more to come on that, Maeve. Does that sound okay? All right, thank you. That was
Thank
great.
you.
All right, I'm going to keep moving us along here. And so just, I'm going to go very quickly with this. This is a brief history of MI. That well, essentially what was happening is that in the 1980s, there was some evidence being that folks in Norway were having better outcomes for patients with use of alcohol and drugs. And so, so what happened was a group of Americans went over to Norway to observe what was happening when they were meeting with patients. And then from that, they started to consider what was happening, and from this started to consider what would be an underlying theory, and what is considered to be a motivational interviewing approach. Along this time, as well, during this time, there was a person by the name of Dr. Carl Rogers, who is he's like the grandfather of modern psychotherapy in the United States. And Carl Rogers had these conditions for therapy. One, that the therapy is very person-centered, so it's trying to work with whatever that individual is working with. That we in therapy, we get a chance as professionals to be genuine with our patients and our customers. That we get a chance to demonstrate empathy, and that we have unconditional positive regard, which is essentially like a very high degree of respect for autonomy and respect for the fact that our patients are taking time out of their lives and entrusting us with their care. And then there are over 2,000 controlled clinical trials of MI that have been used across lots of different areas of change, and they find that on the whole, motivational interviewing can be a very powerful tool for change. Another thing I really like about MI is that it's even more effective when there are issues related to cultural diversity. That this approach, what it does is it tries to get away from assuming that I know what's best, and instead I'm doing more listening and engaging. Just like Maeve, when she came up with the suggestions for what she could do differently, when we do that with people who have come from diverse backgrounds, they feel more heard, they experience more respect, and they're more likely to engage with us and work toward change. I included this. This is a link to, it's called the Network of Trainers for Motivational Interviewing. And this is a really cool site. Essentially what you have is motivational interviewing as an approach. It's continuing to grow and change. And I will, I'm going to just hold up this book right now. I have it as a reference at the end. It's in their 4th edition of motivational interviewing, and this network of trainers site. What these folks do is they post research, they post findings that they're having, and then the theory and the approach changes based on information. And so it's like they're constantly honing MI, which is the way science should work in my mind. Okay, so now let's talk about vaccine hesitancy and motivational interviewing. So I included this cartoon here. It says, I have $5 that says you won't give me a shot and we'll sweep this little matter under the rug. I think that, thinking about this particular topic, I thought we should take a little bit of time to consider what are some of the underlying research-based factors that seem to influence vaccine hesitancy. And we'll take a moment here. Here's just the quote here of, as a healthcare provider, I just don't have it in me to talk about vaccines anymore. I feel like my patients should trust my years of experience over Dr. Google. And you can see this person is trying to be alert with a lot of caffeine and is exhausted. And I think sometimes this is where I have a lot of respect for the work that you all do, especially when we consider how challenging vaccination rates are in the state of North Dakota. That we do tough work. You folks do very tough work. And so sorry for this shocking picture, but I want to highlight this study, and we'll use a little bit on the chat with this one too. So I have a question for this group. So here's what these folks did with this MMR study. They wanted to see what messaging increases the likelihood of parents authorizing their child to get an MMR vaccination. So here we go. Here are our options. So here, I want this group to think about which one works the best. So number one would be when we offer corrective information about the lack of evidence for MMR causing autism. Two, text describing the danger of diseases that are prevented by MMR. Images of children with diseases that MMR prevents, such as the one that's on this slide. Or a narrative of near-death experience of an infant with measles. So which one do you think works the best? Okay, wow, we're all over the place here. We got A, C, D. We got a bunch of Ds. So quite a few Ds. All right, thanks everyone. And I'm sorry, but I've just done a stereotypical thing that psychologists do. It's a trick question. None of them worked. None of them worked well. And in fact, one of these, which I'll get to in a moment, actually made things worse. Made folks less likely to get the vaccination. And in fact, I will call it out right now. Corrective information about the lack of evidence for MMR causing autism, it actually decreased the likelihood of patients getting the vaccination. So, so now I hope you're out there going, what? Now what do we do? So let's keep going here. So why doesn't explaining work? Which is essentially what I'm doing right now, but here's the interesting thing. You folks hopefully aren't ambivalent about learning about this approach or having some hesitation yourselves about learning an approach like this. So that's why me explaining could possibly be helpful. Kristen, I love the emoji that you put up there. So we've been trained to explain, and when we explain, explication, it assumes that the problem is the lack of the correct information or the right information. So the idea is like, oh, this person has this differing opinion from me. Well, I know why. They're lacking the information and insight that I have. And if I just share that with them, it'll correct things and will be great. There is limited evidence support for repeating something over and over again. And you know what didn't Einstein say that that's the definition of insanity? Would be repeating the same thing over and over, or doing the same thing over and over and expecting different results. So here's the other challenge is that even worse, extreme risk negation messages have increased perceptions of vaccination risk. So again, when the person came out and said, oh my gosh, here is what's going to happen if you don't vaccinate your child, that actually increased the perception of vaccine risk. Okay, so now let's talk about some of the underlying factors here. So one that I want us all to think about is attraction to conspiratorial beliefs. So conspiracy theorists. So humans and animals were about predicting danger for the sake of survival. As all of us know, any of us who have ever experienced anxiety, certainly myself included, we know that there are times when it's irrational and it just doesn't make sense. So what happens is that we often tap into some of this irrational limbic system like functioning, and we're about trying to predict danger for the sake of survival. So, with conspiracy theorists, it's this idea that there are shadowy networks of people executing evil hoaxes on the public in near perfect secrecy. Or sometimes it's much less than that, but it's kind of in that direction. And here's the deal with a conspiracy theory is if it helps me make sense of the world, I'm going to hang on to it. And the other thing that's really challenging, and we see it in the news all the time, it's really hard to disprove a conspiracy theory. So some examples, I think about, I once worked with someone who received disability payments for their mental health, and this person was utterly convinced that there are just these evil disability payment workers who knowingly and systematically lie to try to keep disability payments away from our patients. Another one, I remember at Sanford during COVID, we would have a screen that would pop up and say, here are many patients in the hospital with COVID. Here are how many are on ventilators. Here are the number of patients who had the vaccine. And I remember a patient looking at that, pointing at the screen and just saying, that is all a lie. All of that is a lie. Sanford's making this stuff up to try to persuade people. And then the other one that was a favorite one of mine too was the nanotechnology tracking in the vaccine. And I remember a patient telling me, well, the government's tracking me right now as I sit here because of the nanotechnology in the vaccine. Okay, so first factor then is drawn to conspiracies. Another one is disgust and anti-science beliefs. What we find is that another factor for vaccine hesitancy are subclinical fears and phobias about science and medical intervention. So then we avoid what we fear. So, I think, if you slow it down and think, here's what a vaccination is. It is a sharp piece of metal that is going to pierce my skin, penetrate my skin, hopefully get into the muscle, and then a serum that some company has developed is going to be put into my body. And think of how much trust goes with that. I'm trusting the person who's giving me the shot that they know what they're doing. I'm trusting that the serum is going to do what we think it's going to do. There's a lot that is tough for folks in that equation. And so then what disgust leads to the development of attitudes that give people permission to avoid the triggers for the disgust. So if I am terrified of shots and then I hear this buzz about, oh my gosh, I don't think I hear that the vaccination doesn't work. Or with MMR, the idea is I think I've heard the vaccination causes autism. Well, oh my gosh. So then what am I going to do? I'm going to gravitate more to that inaccurate belief, and I'm going to make it my own. Lots of examples with the hospital. Then the last factor here is about reactance. So this idea with reactance is we rebel when others are trying to control us. So people who say, I am a nonconformist. You can't tell me what to do. People who are skeptical of the consensus view. I don't let other people tell me how to think. So then what ends up happening is with people with reactance, they're going to reject the consensus view. So it's good to be immunized is a way, if I communicate my nonconformist identity, I'm going to say the heck it is. So, and then I'm thinking about a friend of mine who lives in Western North Dakota. And I remember calling him during the pandemic and he said, Jon, we don't do masks and we don't do vaccines in Western North Dakota. And that he spoke it like if this is a cultural truth. So people who have this tendency, they're high in reactants. And so what I want to just highlight here is this study that's from 2018. It was a study that was focused on 24 different countries, and they surveyed 5,000 people, and they found that anti-vaccination beliefs were highest in people who strongly identified with conspiratorial beliefs, reactants, disgust toward blood and needles. And I think a very important one for all of us is that education level was not a significant factor. And I think that's another thing that we often think about. It's that we think that people who have these attitudes, anti-vaccination attitudes, that they're less intelligent. And this study suggests that that is not the case. And I think we see lots of different examples in our country right now with very, very smart people who have very, very different opinions from others. And so that, I think that is an important thing to keep in mind. So, okay, enhancing the MI framework. Again, the goal for this is you have a couple of things to do the next time you meet with a patient. So I'm just going to highlight, this is the study that I was part of a while ago, and I'm not going to go into a great detail about this, but essentially what happened was we had the topic was, how do we talk with parents? It was a group of pediatricians. Is there a way for us to be more effective when we talk with parents who have vaccine hesitancy? So what we did was we trialed a more presumptive approach versus the motivational interviewing approach. And the presumptive approach was, essentially saying to the patients, hey, I really care about you and your family. I have a lot of training. I'm a healthcare professional. Please let me help you with this decision. And so it's very directive, and it essentially presumes that the person is going to be willing to take the vaccination. And we compared that to MI. The important takeaways with motivational interviewing, we found that some of those pediatricians, they dreaded these conversations so much that they admitted to avoiding them sometimes with patients and their families. And so I think a great takeaway was the folks who were trained with the motivational interviewing approach, they had more confidence, less anxiety, and they were less likely to avoid talking about vaccines after having some MI training. And it was too small of a study to know. We never got to the place of figuring out, was the presumptive approach, was it more or less effective? But we couldn't reliably do that. But we had this nice takeaway about improving confidence, so that they were at least more willing to have the conversation. So with MI, here, I said this earlier, if you understand the spirit, that's about 75% of the way there. And so here's the spirit of MI, that we're partners in this, that our patients are the experts of themselves, that we work on acceptance, and that with that, we're non-judgmental when we're with other folks. We demonstrate compassion. And so that our intention as healthcare professionals is to alleviate suffering and to support positive growth. So when we embody this, we get to be human in this approach, which I really appreciate. We can say things like, wow, that sounds really challenging. And we're about, with motivational interviewing, we're about empowerment. We want to support autonomy. And then to consider, when we're with patients, we are doing one of these three things. I'm either following, directing, or I'm guiding. And I'm following is, so here's a patient telling their story. Oh my gosh, you're never going to believe what happened. Here's what's going on with me. And if I'm listening, I'm following. Or we're offering direction. Like, here, okay, you're wondering about how to get a better night's sleep. Here are some things that you can do. But guiding is when we are encouraging, motivating, and the MI approach would say that we don't get enough time in healthcare to be guides. And I want you to think about, like, and I'm just going to talk a little bit about, I'm going to jump through this one pretty quickly. So when we're guiding, what's great about that is that we get to share the responsibility of change. We get to see each person as unique. And in that way, I don't have to give the same spiel over and over and over again. I get to tailor it. I get to listen for and try to draw out change factors from the patient, and I get to tailor my education. So there's 4 fundamental tasks in MI. The first one is they call it engaging, and so the idea is, can we walk together? And we're going to spend pretty much the good chunk of the rest of our time together on this engaging. So again, if you think about a good guide, the good guide is first going to think about, like, are you and I, are we able to walk together? Are we able to go on this healthcare journey together? So how do we engage? Another task is focusing, to say, once you know that we can walk together, it's where are we going to walk to? And evoking, how would you go there? Or sorry, not how, why would you go there? Why do you want to walk? Why do you want to make this change? And then the planning part is, how will you get there? So those are just some of the fundamental tasks. And if you think about, in an interaction, we're doing a lot of these different things sometimes at differing times. So this first part about engaging, can we walk together? And what this does is it helps people feel, when we're doing this well, it helps people feel comfortable and safe with us. We talk about psychological safety. We establish trust so that patients are willing to share their true concerns. And we gather information for the work with the patients while we're doing this step. And so with that, here are the tools that we use. We use mirroring. And I'm going to talk about mirroring in just a moment. I'm going to get to some of these examples. And then we use skills like open-ended questions, affirmations. We offer reflections, and then we summarize what we're hearing our patients say. So I'm going to focus a little bit on mirroring here. I'm going to give some examples. So reflecting, essentially what we're doing with mirroring is we are demonstrating that we're listening. And this is my challenge to this group today, is probably one of the more important things that you can take away from this today, is we need to be doing more mirroring or reflecting back to our patients than we normally do. And I'm going to say I'll show you what that means in a minute. But again, when we are listening in motivational interviewing, essentially we're talking. Like, I am offering suggestions. So then I want to get to the examples that folks have given here. So, sorry, I'm just cognizant of the time here. So here's an example. So an example of mirroring is that, so the patient comes out, or the speaker comes out to the provider and says, I really don't want to get vaccinated. Which, if you think, that's a pretty bold thing for someone to be able to say. And so what I'm doing in motivational interviewing is I'm going to reflect back what I think the person is telling me, but I'm not just doing it willy-nilly. I'm doing it with direction. Another thing that is really common is that people, when they hear motivational interviewing, they say, well, isn't it just going with whatever the patient wants? And that's not entirely true. If I'm you, I want my patients to be vaccinated. So I have direction. So I'm going to reflect some things back that I hope try to evoke change from the patient. So this person says, I really don't want to get vaccinated. The listener says, you're not concerned about getting sick. So to think that, this person says, I really don't want to be vaccinated, the listener's saying, oh my gosh, okay, so what do I want to reflect back based on what this person's saying? And this person reflects back, you're not concerned about getting sick. The speaker comes back with, well, I am worried about getting sick from the vaccine. And then the listener comes back with another reflection and says, you've heard some stories about people who got it. And the speaker says, I've just heard it's dangerous. The listener says, like, the vaccine might be worse than the virus itself. And the speaker comes back with, I just don't like having things injected into my body. And the listener says, it feels to you like being out of control, like it's a lot to trust, a leap of faith. And the speaker says, well, I've had vaccinations before. I just don't know about this one. And the listener comes back again with, something seems different to you about this one. It worries you. So we have to keep in mind, here is someone who is interacting with a healthcare professional about vaccinations, and they are willing to have a conversation. Probably the person is ambivalent. There's probably part of them that wants to consider taking the medication or having the vaccination. And there's part of them that's scared or has a different belief about it. And so what we want to do in motivational interviewing is we want to try to avoid getting into lecture mode, because when we start telling patients about all the reasons why they should take the vaccination, what's happening inside of them is the yeah buts. They're hearing you say you really need to take the vaccination and here's why, and automatically they start thinking, yeah, but I had a neighbor take this and they got really sick. And so I think it could actually do more harm than good. And then we come back with another lecturing point. And so what happens is that the folks, when they're ambivalent, it's kind of like they're on a teeter-totter that's balanced to the ground. When we put all the weight on here's why you should change, we automatically counterbalance that with all the reasons why we shouldn't. And so instead, what this person is doing is they're just reflecting back what the person's saying. So I'm going to just go back and try to grab a couple of the examples here with folks. Heidi wrote in here, I just often don't feel like taking my medications. And the person gave a little bit of explanation of asthma, hypertension, or otherwise. Background that the person has severe depression. So here's somebody who's severely depressed, and they say, I don't feel like taking my medications. And then what are our choices? Some of us want to get in there as a cheerleader and say, oh, yes, you can. You really need to take these. But this person is more than likely just ambivalent about this. And so if this person said, I just often don't feel like taking my medications, I could see myself saying something back like, it just doesn't seem worth it. Now, what am I doing there? I'm reflecting back what I think they're saying. And what's interesting when you do that is that now we might get a different kind of yeah, but from the patient. So you say something like, it just doesn't feel like it's worth it. And the patient could either come back with, yeah, that's right. And then they could explain more, or they could come back with a different kind of yeah, but they could say, well, it sometimes doesn't feel like it's worth it, but my family really needs me. So it changes the conversation when we're making these guesses. So I'm going to grab another one here. So medical providers don't make any money from healthy people. No motivation for them to make us healthier. Medical providers don't make any money from healthy people. No way. I guess I'm sorry, I'm blanking on where that one's going. Maeve, do you have any idea about where that one's going?
I am not quite sure.
Okay, thank you. And I'm going to jump to this one here. I get a lot of comments as I'm talking to patients about the importance of vaccines and trying to convince them to get them, especially HPV. You're only saying this because you're in healthcare and told to say so. So let's pause there. And if someone were to say that, I want you to think about like, what could I say that would mirror something back? And so I could see myself saying like, so it sounds like you know something about HPV, and what you're saying is that it's really not necessary for you to get this. That would be something that you could reflect back. You could also say, so you're only saying this because you're in healthcare and told to say so. I could see myself again, depending on the situation, reflecting back. You're saying that we're just in this for the money in healthcare, and that in a sense what we're doing is we're really trying to sway or manipulate people. And from that, I mean, you're going to get a reaction. And again, I'm reflecting what I think I'm hearing, and it'll be interesting to hear that, because now what they have is they're sitting across from someone who's listening to them intently and appearing like they care, and they're reflecting this back of just like your thought is that I'm just here to manipulate you. And then it'd be interesting to think what happens when you make a statement like that, to think, what does the patient hear when you say that back? How would we combat online misinformation? Like Facebook, mom groups are big on this. Crunchy moms. All right, so the idea, so someone comes in and says, well, that's not what I'm hearing on this Facebook site. And what I could hear myself doing in a situation like that is reflecting back to that person, the health of your child sounds like it is extremely important to you. And it sounds like you're reaching out to get information wherever you can get it. So, and I guess maybe I wouldn't add that last part. I wouldn't want to be inflammatory, but making a statement back to say, wow, the health of your child is so important that you're looking to other resources. All right, let's see. Another one here. Oh, that related to motivating patients to have preventative care office visits, or that the patient feels the doctor may be trying to make them sick. Okay, so, I'm just, that idea of like, oh, you guys just get money when we show up and you guys just want us to do healthcare. Again, I could see myself reflecting something back about you're skeptical about the whole process of healthcare. And again, what am I doing with that? I'm trying to say that I'm hearing you, and I'm trying to do it in a non-judgmental way, and I'm trying to encourage more conversation. And again, usually when you say something like that, you'll get a response back like, well, it's not all of healthcare. You seem nice, or something along those lines. And then you've got a place to go in terms of conversation. Let's see. I'm going to move on here. There's some guidance about a strategy from the CDC using motivational interviewing and this was recommended for vaccine hesitancy. It's to really try to embrace an attitude of empathy and collaboration. And another takeaway from this group, I'd like you to try asking for permission to offer information or make suggestions to your patients. That's another thing what it does is it just doesn't make it like an automatic part of what you do. Is I'm just a suggestion dispenser. And instead, I do things like I ask my patients, hey, I've got an idea about this. Would you mind if I share it? And when I say things like that, my patients sometimes will look at me like, duh, yeah, this is why I'm here. Please share. But there are times when the patient says, I have another idea about this, and then they'll put out their idea instead. But when I do that, it demonstrates respect. And so we do this when we do the challenge for this group is to do this with vaccinations, to say, is it okay with you if we talk about vaccinations? Or the way it's phrased here, if it is okay with you, I'd like to take a moment to discuss vaccinations with your family. And if the patient says no, respect their decision. And I would come back with, I respect that. Would you be open to discussing this more in the future? Or what I often do instead is I will just be curious and say, I respect that. Would you take a moment and help me understand why you don't wish to discuss this topic? And if the patient says that they are willing to discuss it, then we can do things like use a scaling question. Okay, today on a scale from 1 to 10, how likely are you to get this vaccine today? And then what you get to do is you get to explore. And if someone says, so in motivational interviewing, if someone says I'm a 5, in motivational interviewing, we'd say, well, why are you a 5 and not a 1? So that we're trying to get at what makes them think that the vaccine might be okay? And then we respond to those questions. I'll round this out with, I got 2 slides left. This is a group of resources for folks, and I realize we're just at 1 o'clock. And then, if I was you and you're interested in this more, I would encourage you to pick up this book. It's called Motivational Interviewing, Motivational Interviewing in Healthcare. It's the middle resource there from 2023. And I would grab a group of work colleagues and see if you guys can put together a book club and start looking at this together. And then there's that motivational interviewing site. They have examples of interviews with patients, and it's a really helpful site. And there we have it. Thank you, everybody.
Thank you again, Dr. Ulven, for all of your expertise and for spending your time with us this afternoon. We appreciate it.